This is a left ventricular assist device, or LVAD, used for heart failure patients. So what's the problem? The problem is that LVAD patients have too weak a pulse to properly measure blood pressure, leading to stroke in this patient population. Now, 9% of LVAD patients develop stroke as a result of poor blood pressure management. What's the solution? Our device. We have created a device that can measure weak pulse in LVAD patients and provide better blood pressure management. This is a prototype of the device. So why now? We have invented a device, a solution that did not exist before. A device, a functional prototype of a device that is backed by data and already has a patent in place. Why is this a problem? This is a problem because there are 26,000 LVAD patients in the US alone, and 9% of those patients develop stroke as a result of poor blood pressure management. With our device, we can reduce the risk of stroke in these patients and save about $57 million in healthcare costs. Now, why us? My team is made up of the engineer who invented the device, 2 LVAD cardiologists, and a physiologist conducting research on the LVAD product at the Mayo Clinic, along with an entrepreneur working on the investment activities and marketing options. Now we would like to invite you, investors and advisors, to join our team to better the lives of the LVAD patients. Thank you.
Thank you. And now Vincent will take questions.
More to the business model, how much you're going to sell the device for, how the device is sold in conjunction with LVAD, and a little bit more around that business piece.
Okay, so are you referring to the market in terms of cost financially or the distribution channel?
Both, actually.
Okay, so we came up with that market size based on the number of LVAD patients. So there are currently 26,600 LVAD patients in the US alone. And the cost of care of stroke is $48,000 per patient due to poor blood pressure management. There are 9% of those patients who are at risk of developing stroke due to that poor blood pressure management. So when you multiply the number of LVAD patients by the 9% and the cost of $48,000 of stroke, you get that market size, which is about $115 million. Now, what we want to do in terms of business plan is we know that at least in the first year, we want to target 10% of that population, starting with throughout the Mayo Enterprise and our collaborating centers. And in the additional years, we hope to reach at least 50% of that market size. Does that answer your question at all?
It answers part of the question, I guess, what the overall opportunity is. I was wondering, have you validated how much people are willing to pay for it and how you sell it, et cetera?
Okay, so market research. Yes, we did some market research. We have our LVAD cardiologist here who spoke to more than 90 patients as a market discovery. We spoke to LVAD surgeons and healthcare providers for LVAD patients. We spoke to insurance companies. So we spoke to all of those and realized that this is a need worth addressing, because currently you cannot measure blood pressure using the existing blood pressure device. It has to be done using a more difficult approach by healthcare providers only.
Thank you.
So this is a device that would use in hospital, or is it a consumer-based device to be used in the home?
So there is opportunity for the device to be used in hospitals, inpatients and outpatient, as well as at home. And hopefully the opportunity lies where the patients can use this at home, because currently they have no way of measuring their blood pressure at home. They have to go to the hospital each time they need that done.
Can you speak to whether your market sizing is based on new patients annually, or is that the cumulative amount of patients with LVAD therapy being delivered?
Okay, at this point, the market size is based on cumulatively the number of patients that are currently in existence, but heart failure is increasing, and heart transplants remains limited. So this number will significantly increase as the years go on.